Hey students, welcome back. It is a new day. Hopefully you're doing all well, that you're able to see the first video for class. Thank you for your responses on YouTube. Make sure you're constantly putting comments on there. That is a key way for me to know whether or not you are attending and participating in this course for your points. All right. So if you have like a weird YouTube name or something like that, I've had a couple of you students already contact me about that, just so I'm aware, but I think it's pretty straightforward. I understand who is who. Even if you want to just type your name, Tony, that's perfect enough. I know who's who because I only have one person of each in our classes right now. Last week we covered lessons 1 through 4. Today we're going to jump into before giving care. So look at that portion in your participant's manual. That's the book to go with. If you haven't picked one up, you need it. You need it immediately, because what I'm going to require is for you to take a picture of it with your first aid kit. I need your name in marker written on that first aid kit, because again, we all have to have our own. We can't be sharing these things, all right? But I need you to have a picture of this with your first aid kit. If you want to smile with it, that's even better. I love it. But the main thing is I need this participant's manual that you have purchased. I need that first aid kit. That's part of your points. Before giving care is one of the biggest tests that we're going to have. It's our first 30-question multiple choice exam. Questions are really straightforward if you read them correctly. So this information is going to provide you with the knowledge to pass that test with flying colors, hopefully so. So basic introduction. In any emergency, your top priority is to ensure that your own safety, including, right, is number one. So for your own safety, how do we protect ourselves? Well, first off, personal protective equipment. We wear our non-latex gloves. That's going to prevent disease transmission. Another thing is having that breathing barrier available. If you use a breathing barrier, right, we are also protecting against disease transmission as well if we have to perform CPR on an individual. So these are our key things, our personal protective equipment. Next is properly moving a person, right? Because again, you might have to move somebody if the situation is unsafe for you or the victim. And how do we move that person properly without aggravating their injuries anymore? And then lastly, basic legal information is important for us to know. Preventing diseases, we're trying to prevent against bloodborne pathogens like bacteria and viruses. And these can be present in bodily fluids and blood as well, which cause disease. So that's why it's important if we wear our gloves, we wear our breathing barrier, or not wear our breathing barrier, but use our breathing barrier during CPR, we should be absolutely fine no matter what. Now, because some infectious diseases are very serious, you want to protect yourself and others, right? So common sense, glove up, protect yourself. The disease process begins when a pathogen enters the body, and it can kind of go really fast from there. So if you do feel like you have been, I don't know, if you are carrying a bloodborne pathogen or something like that, go to a doctor immediately. Go get a checkup. Make sure you don't have any of those things going on. Back to the information, though, instead. How can we spread disease, right? And that's going to come with contact. We have to have contact with the material, that is the blood or the bodily fluid. So there's different ways we can contact things. Right? If I were to get a big gash in my arm and you just go ahead and slap your hand on top of the open wound, you just made direct contact with my blood and my open wound. So we can contact, or we can transmit diseases via direct contact. Oh, hello. Sorry, back to you. Direct contact by squeezing on it with our bare hand. Indirect contact, on the other hand, would be, say for instance I had a gauze that was soaked in blood, or tools soaked in blood or bodily fluids, and I touched them with my bare hands. That's indirect contact. So direct, actually physically touching a body part with blood or bodily fluid. Indirect, grabbing something that is soiled. Standard precautions, PPEs, personal protective equipment, non-latex gloves. We always clean up messes with that. We always put those on right away while we're talking to the people. So if, say for instance, you come upon a scene of a severe bleeding accident, you luckily have your first aid kit or materials with you. So as you're approaching the scene, right, make sure it's safe, you put your gloves on before you actually touch the person or give them any kind of care. Of course, introducing who you are so they know that you are certified and can actually give them proper care in the first place. We always wash our hands. So if you don't have access to water and soap right away, right, that's why we put our PPEs on. We're protected, they're protected. But if we have the time to wash our hands, let's go ahead and do that. 20 seconds is the key. This is on your first exam. How long do we wash our hands for? 20 seconds. Scrub them back and forth between the fingers, underneath the nails, around the thumbs. Try to go all the way about halfway up the wrist is best, if not further if you can. Again, 20 seconds is that time frame. For post-care, again, wash your hands again. Take off the gloves, wash your hands for 20 seconds minimum, and you should be pretty much safe from there on forth. Always clean up messes then properly too. So say if there is bodily fluids on a table or something like that, we want to use cleaning supplies to get that cleaned up properly, and then use some kind of disinfectant then as well to make sure that you've killed any virus or bacteria that would be associated with that blood. Now, taking gloves on and off is one thing. Okay, that is actually a skill that we need to know. And I'll probably have you do this skill later on for me, when we do have that time to actually see each other in person. But I'm going to try and put these gloves on, but sorry, I got some sweaty hands going on right now. This is how I go. Hi, my name is Kyle. I'm certified in first aid. I see you had a pretty bad fall right now and you're bleeding pretty profusely. May I help you? They usually say yes, right? If you put your gloves on, right? That's your first step. Just like in that video that I showed you where the guy was diabetic and he was like laying there on the table. He's drunk, No, he's not drunk. He's having a diabetic emergency. The girl put her gloves on right away. Okay, so these are a little small on me, but they work. Try to get a pair that fits you, honestly, right? So here we go. Got my gloves. How do we take our gloves off? This is the key thing. To take our gloves off, go ahead and follow along. Whichever hand you want to use, pinch at the palm of the one glove and then pull it off and wad it up inside the other hand. Once it's wadded up inside that other hand, grab at the wrist so that way you're not contaminating yourself, and then pull it all inside out. And now all the contaminated bodily fluids are held within inside the gloves. Throw those into the proper waste receptacle and you should be good to go. Again, still wash your hands. I would. Obtaining consent, okay, this is a big thing. We have to obtain consent to give care, okay? If we don't have consent, then we're in the wrong. So, people have the legal right to refuse care from you. So get consent. The way you can identify that is to say, first off, hi, I'm so-and-so. I am certified in first aid training by the American Red Cross. May I help you? From there, they say yes or no. Sometimes even explaining what you see. Oh, I saw you took a bad spill right now and you're not walking exactly straight. You might be concussed. My name is Kyle. I'm certified in first aid. May I help you? Plain and simple, easy way to start it off. Always explain what you do before you actually go ahead and do it then too. Other types of consent now that we have, right? Expressed, that's first and foremost. That can be a conscious, competent adult, gives you permission for care. Plain and simple. Yes, please help me. Basic. This can be verbal though, or nonverbal. So sometimes people might have speech problems or they might be concussed to a point where they can't speak or something like that. A nod is sufficient enough. Yes versus no. For a child or infant, entirely different. Now we must obtain consent from the parent or guardian. Now if you are the T-ball coach, you are technically the guardian in that situation, so you don't even have to ask to help the child. You just go help the child. Okay, but if there's no parent or guardian around, you must ask the child where your parent or guardian is. If they are there, get consent from that person. If they're not there, now you assume consent has been given, because if it was my child, right, I hope to God somebody who's certified in care is going to help my child in that situation. I hope they would. Implied consent, okay, so that's where that comes in. Implied consent applies to children or infants if a parent or guardian is not present. Okay, you'd want them to help. Other things then too. A person is unable to give expressed consent because they are unconscious, right? Or they can't respond, they're confused, they're mentally impaired, they have such a serious injury or illness, they can't respond. Again, we assume they'd want help, right? If I was knocked unconscious, I hope somebody would give me CPR if I'm not breathing, right? So there we go, implied consent. The law assumes if a person could respond, he or she would agree to care. So you are protected by the Good Samaritan law, and you cannot get sued. The worst thing for you to do is not help at all. Now you can get sued, especially if somebody sees you walk away from the scene without at least, trying to figure stuff out or calling 911. Other things then too, okay? Once you begin giving care, so they've said, yes, go ahead and help me, okay? You are legally now obligated to do no further harm and do proper care for that person. So one, there are 3 reasons why you would stop or not give care. Number 1, somebody equally or higher trained than you takes over. That's a good reason to stop giving care once they've given you consent to help. The second one would be you are physically unable to continue. So, right, you're giving CPR, you are dead tired, you gotta take a breather, you stop for a minute and then get back into it. Or if the person is competent and they say, no, I don't want your help, wipe your hands clean, walk away. You've done your job. Okay? If you stop without a valid reason, you are now legally responsible for abandonment of a person in need. So give care always and give quality care always. As I said, that Good Samaritan law is what's going to protect us. So you give care within your scope of knowledge. We're not doctors here. We shouldn't be using scalpels. We shouldn't be trying to stick our fingers in people's mouths without the proper knowledge base, right? We need to be very careful here. So as I tell you through this course, what we're allowed to do, that's all we're allowed to do. Don't push any farther than that. 911's there to be called, right? They're the ones that are the professionals that are going to help this person in the more dire situations. Now, when it comes to reaching and moving a person, okay, these are very important, not only for that person's safety, but your own safety as well. You don't want to get yourself hurt during the process, and now we have 2 persons that are injured. So one of the most dangerous threats to a severely injured person is unnecessary movement. Why move them if we don't need to, right? There's no roof coming down from a burning building. I don't smell gas. There's no immediate danger around. Let's leave the person in the position found, ask them questions if they're conscious. Calling 911 is probably the best thing we could ever do, so they're on their way to help transport that person the correct way. Okay? Move a person only when you can do so safely and only when faced with immediate danger, only to get only to get another person with a more serious, only to get to another person, I should say. I'm saying that wrong. So when you're faced with immediate danger, okay, that's a reason to move a person. If the person that you're moving is in the way of getting to another victim that is more seriously injured, another good reason to move a person, right? And then lastly, if it is necessary to give proper care like CPR, that is another time we move a person. So say for instance somebody's laying face down unconscious, we tap them, are you okay, are you okay? And there's no response. Somebody call 911, this person's unconscious. We're gonna have to flip that person over as carefully as possible with the correct technique to ensure that we can open up their airway, check for breathing, check for circulation, and determine whether or not we need to give CPR. Now, consider these limitations now too, okay? You are yourself and then the person that you're moving, okay? How dangerous is the scene? What are the conditions, okay? The size of the person could come into play then too, right? If you are only a 100-pound girl and you gotta move a 300-pound man, good luck, right? But we're gonna go and discuss some ways in which we can make this a little bit easier, and I'll make a specific video just based on these skills alone for your viewing pleasures. Distance the person must be moved, right? If you got to drag somebody 10 feet, big difference compared to 150 feet. So can you do that by yourself safely without getting injured? I don't know. Can you move that person effectively that distance without making their situation even worse? Who knows? We got to see the situation. So your physical ability is big on this. The size of the person is big on this. The condition of the injury is big on this. If you can get others to help, that's always great. And then also, how far away is equipment? Is it better to go get the equipment and bring it back, right? Sometimes that's a better case scenario. For emergency moves, we always want to protect ourselves first and foremost. And when we are moving individuals, it's a very physical task. First off, you want to use your legs. You don't want to use your back, and you want to bend at your knees. The knees and the hips are where the strength is going to come. So if we can get into a squat position and stay low and avoid twisting our body, we're going to be able to move people much more effectively and safely for them and for ourselves. We always want to maintain a very firm grip on whatever we're doing then too. So if we are doing like a two-person seat carry, we have to be strong. If we're doing a blanket drag, we have to hold on that blanket as tight as we can so we don't slip and fall and hurt ourselves in the process. If we're walking forward, we should be taking small steps and looking where we're going. We should avoid twisting or bending anyone with a possible head, neck, or spinal cord injury, right? So we have a victim like that, we don't want to twist them, we don't want to bend them, we want to keep their body aligned. We do not move a person who is too large to move comfortably. So that's where that scenario of 100-pound girl, 300-pound man, how are you going to pull that person out of the situation? You ain't going to do it. You call 911 immediately, get some more help. And always use good posture in general. Now, if you go into your book, okay, again, your participant's manual, this is your, so to speak, your little go-to for everything. And I want you to go to page 12, okay, in your book, page 12. There's some really good pictures, and right here is where we're going to start. These are your emergency moves, and I want you to practice these at home for now with your brothers and sisters, aunts and uncles, mom and dad, grandma, anybody you want to, as long as they are capable of doing so, right? You don't want to hurt them. So first off is the walk assist. This one's pretty basic. We can do a one-person or a two-person walk assist. So if you look at the picture, the person that's injured, right, what you're doing is you're putting their arm around your shoulder and helping them or guiding them to a place where you want to take them. This would be a great example for like a concussion, right? Somebody hit their head and now they're not moving the correct direction to so go sit on the bench from a soccer game. You want to put their arm over your shoulder and walk them to where you need them to be and sit them down carefully. We don't want to aggravate the injury at all. So with this type of movement, this is for not suspected of head, neck, or spinal cord injuries. We're thinking more along the lines of, well, a head injury is concussion, but if it's a mild concussion, yeah, they're already stand up moving them. That's understandable. But if we're looking at like, right, a broken arm, we're looking at a broken leg, okay? These are good examples of different types of walk assists we can do with that person to protect them. Now, usually what we're gonna go ahead and say is that if somebody has an injured leg, say it's their left leg that's injured, you'd wanna approach them on that left side, all right? Because you're essentially going to be the crutch for that body part. Every step they take with that body part, you're gonna let them bear all their weight onto you so they can use their good leg to support their body, and you support the rest of their body with every step you take. It's not a very fast process, it's very slow moving, so patience is key here. Moving 100 feet could take you a whole minute. That's fine. Speed's not a part of this right now. Now moving into other types of movements. Still the same pages, page 12 and 13 here. The two-person seat carry is awesome. This is great if you need to move somebody quickly and safely as well that is not suspected of a head, neck, or spinal cord injury. Say, for instance, Tom rolled his ankle so bad he can't even move out of the situation, right? In that case, you have two people pick him up underneath his thighs, so he's sit like in a seated position. You both put one arm around his back and link on to each other. By holding each other, you're going to guarantee that you're not going to drop the person that's injured at all. And then make eye contact with the person helping you and walk together as a unit without bending or twisting too much. The next one is a backstrap carry. This is by yourself, and try this at home. If you do, try it with somebody who is equally sized or smaller than you. Preferably smaller if you have weak legs, because it can feel very heavy. But mainly what you're going to do is have them behind you. You're going to squat down as low as you can, take their arms and put them around your neck, and then as you stand up and tilt forward, you're going to lift them up into the air. The picture shows it really well. But in the picture, if they're conscious, you'd like them to bend their knees so that way their feet don't get dragged across the ground or get mixed up with your feet too, and then you both go falling down. The next moves are very important to note because these are especially when we have head, neck, or spinal cord injuries. We do not move anybody in any situation with a head, neck, or spinal cord injury unless we're using these two methods only. And those two methods would be the closed drag and or the blanket drag. Now the closed drag can only be so effective. It depends on what kind of shirt they're wearing. So if I'm laying unconscious on the ground, if somebody were to grab me by the collar of my shirt and pull up, my armpits are going to catch, right? And it's going to pull me and drag me in whichever direction they're going to pull my head. The great thing about being over the top of somebody is you can grab them on either side. So if we got the dummy, Mr. Dummy right here, right? What we're looking to do is position our hands on either side of their head here and grab their shirt. By creating that leverage there, it's going to ensure that their head stays in alignment so it doesn't go side to side, Again, head, neck, or spinal cord injury, we want to prevent any worse trauma going on. Also, a great thing about grabbing here, right, is that it's going to prevent those muscles from working as much, especially with the twisting of the head. So if they do become conscious, they don't move as much. You want to keep everything in alignment. And again, like I said, I'll show you this in another video for skills. Jackets work best for this. Make sure it's zipped up, obviously. If it's a material shirt that's very weak, I would never suggest using a clothes drag because you're going to either rip the shirt off them or fall down or something worse. The blanket drag is the go-to for any and every situation almost, mainly because it can help you move somebody who is extremely heavy very easily. The blanket is going to be a barrier between the ground and that person, so that way you have more slip, less resistance, and then you can move that person around much more effectively. The blanket drag also creates an awesome cradle for the person's head, right? The only downfall to both of these moves is that we're walking backwards, but we're pulling the person. So we have to really observe and see what's behind us while we're doing this action. We want to stay low with a very strong grip and pull that person constantly at the same rate so we're not causing any kind of jostling around. Now what I like to do, and I'll show you this in the video, is once you have the person on the blanket, which I'll have to show you how to get the person under, on top of a blanket once they've never had a blanket underneath them, but we're going to take the ends that are by their head and twist them together. So when we pull, it keeps their head cradled perfectly in position. The last move that we can use is called an ankle drag. An ankle drag is like a last resort. Got to move this person out of the situation. No suspected head, neck, or spinal cord injuries. No suspected lower body injuries. Right? They're unconscious. We got to drag them out of the burning building. We don't see any injuries. Let's get them out as fast as we can so we don't get ourselves hurt or them hurt in the process. I do never recommend going into a burning building. If you're in the burning building already and get that person out, that's good, right? Okay, jump ahead. So part 5, lesson 5 is done before giving care. I want to jump into the human body briefly. I'll have another video posted for you to see, and we'll call it a day, and we'll get back to class on Friday. The human body, it's very important to know some basic anatomical terms just so you can better understand and recognize injuries and illnesses too in the long run. So if you look at your booklet, I'm going to flip ahead to these pages here, see if I can find it for you. Move to page, or I should say chapter 2 is some of this information. It does have some anatomy in there with the heart, but you can refer to any kind of booklet with a diagram that says anatomical terms. For your viewing pleasure, just to show you, this is my little example here. Okay, there's a body standing, and if you just type that in on Google or whatever, this pops right up. But the main terms you want to know or get more familiar with is anterior and posterior. Anterior is the front, posterior is the back. Front, back, we can use those terms interchangeably for us. Superior versus inferior. Superior is up, inferior is down. Frontal or coronal plane. Well, this is when we cut the body into sections, and this isn't as important for us, but it's good to know in general for anatomical terms. So a frontal or coronal plane, that's like imagining there's a plane cutting through my body here, so we have an anterior and posterior portion. A sagittal or lateral plane is taking the body and cutting into equal halves. Well, that's mid-sagittal, down the middle. So if I had a plane, I'd have a right side and a left side. We can do it here too. Now we just have unequal portions. Sagittal section, mid-sagittal, down the midline. Transverse or axial, that means we're taking a plane and we're cutting it through, like for instance my chest straight across, so I have an upper portion and a lower portion of my body. Medial and lateral are more important for us. Medial means more towards the midline of the body, so towards the center, versus lateral, towards the outside. So my shoulder is lateral to my sternum. My sternum is medial to my shoulder. Proximal and distal are terms that we use strictly for the appendages. Proximal and distal. When we're saying proximal, proximal means more towards the midline or towards the center. So my shoulder would be the most proximal portion of my entire arm. Versus distal, furthest away from the center, that would be my fingertips. My fingertips are most distal from my torso. Superficial and deep, I think we know this. Superficial scrape versus a deep gunshot wound. Deep, yeah, pretty basic. So internal and external. Internal wound, right, underneath the surface of the skin, external wound, we can see blood, we can see bodily fluids, we can see bone, so on and so forth. And then right and left, right? Straightforward. I think we got those terms. A couple more to know. You might say this to the person. Can you, if they're holding your elbow, right? How bad is it? It hurts. Do you feel like you can move it? Maybe they can only extend it or flex it. They can't move the shoulder in and out. So we're kind of determining where the injury lies. If they have an elbow injury, they're probably not going to be able to extend or flex their elbow too much. They're probably going to be cradling it. A few more anatomical terms to touch on right now. That would be the position the person is found. Okay. If the person is lying flat on their back face up, this is called the supine position. So you can basically just, like a bowl of soup, put your palms face up. Supine position. This is the anatomical position, face up. Prone, on the other hand, would be face down. Sometimes we will approach people like this. Prone, we tap them on the shoulder. Are you okay? Are you okay? No response, we call 911 right away. We have to carefully rotate that person, which, again, I'll show you in a skills video. Left and right lateral recumbent position. These are on the sides. So you're laying on your side, usually with one leg over the top of the other, and then the hands cradling the face. So if they do vomit, right, they're not going to choke on it. The vomit's going to come out of their mouth, no problem, and they're in a comfortable position. And last but not least, the last one is called the Fowler's position. Fowler's position is simply just seated with legs straight. It's very hard for some kids to do these days, I've noticed. Final terms, and we'll call it a day. Major body cavities. The body has many cavities which house different organs, and the great thing about these cavities is they prevent, I guess you'd say contamination across these different cavities then as well, or keeps blood in certain positions so that way it's not bleeding everywhere in the body. So if you look in your booklet, there should be anatomical terms towards cavities. The cavities that we're going to cover are the cranial, spinal, thoracic, abdominal, and pelvic cavities. Plain and simple, the cranial cavity is within our skull, houses the brain. The spinal cavity houses the spinal cord that run through the vertebrae. The thoracic cavity is everything from the respiratory diaphragm upward. That would house the lungs as well as the heart. We move below the respiratory diaphragm and we have the abdominal cavity where the most of our internal organs are, like our stomach, liver, right? Small and large intestines. Let's go ahead and move down a little bit farther to where our pelvic bone is, and everything down that region is the pelvic region. That's going to contain organs like the latter end of the large intestines, the urinary bladder, and the reproductive organs as well. Now there are some organs that lay outside, or they're called retroperitoneal, and these would include the kidneys with their adrenals, adrenal glands I should say, the pancreas, as well as the spleen. These are lying outside. And if we see problems with these or notice problems with these, we're looking more along the lines with these cavities at internal bleeding or internal hemorrhaging of some sort. Blood is going to collect in these cavities only. Now, with that being said, right, there could be multiple cavities open. That's why it's good to make an observation, pull up the shirt, see if we see blood pooling in the chest, it's in the thoracic cavity. We see blood pooling in the stomach, abdominal cavity. Straightforward. All right, we're at a good point. Thank you so much. We'll jump back into it next time in class. Do some reading ahead of time because we're going to start jumping into other information related to checking an unconscious and checking a conscious individual for Friday. Thank you.